Welcome to This Week in Infectious Disease. This week we're covering 6 notable papers spanning pediatric pneumonia trials, microbiome dynamics in transplant recipients, influenza antiviral utilization, tuberculosis biomarkers, and vector-borne and vaccine-preventable outbreaks. Let's dive in. Turning first to respiratory infections and global child health, the Lancet published findings from the PediCAP trial, an open-label, parallel group, 2by5 factorial randomized controlled trial evaluating oral step-down therapy and shortened antibiotic durations in 1101 children aged 2 months to 6 years hospitalized with severe community-acquired pneumonia across 13 hospitals in 5 sub-Saharan African countries. Children were randomized to oral amoxicillin or co-amoxiclav versus intravenous-only treatment, and across 5 total durations ranging from 4 to 8 days. The primary outcome of readmission or death at day 28 occurred in roughly 6.9% of the co-amoxiclav group, 5.6% of the amoxicillin group, and 6.3% of the intravenous-only group, demonstrating that both oral step-down strategies were non-inferior to intravenous-only treatment. Furthermore, all 5 total durations including the 4-day course were non-inferior to the 8-day group, with primary outcomes ranging from 4.1% in the 4-day arm to 8.3% in the 7-day arm. While efficacy was comparable, adverse event rates increased with longer randomized durations. For clinicians managing pediatric community-acquired pneumonia, these results support stepping children down to oral amoxicillin as soon as clinically stable and utilizing shorter total courses of around 4 to 5 days, avoiding unnecessary prolonged intravenous lines and broad-spectrum agents. Examining immunocompromised hosts and microbiome-driven risks, the Journal of Infectious Diseases featured a prospective single-center study investigating enteric microbiome features that contribute to bloodstream infections in hematopoietic cell transplant recipients colonized with fluoroquinolone-resistant enterobacterales. Among 26 colonized participants, 9 subsequently developed fluoroquinolone-resistant enterobacterales bloodstream infections while receiving levofloxacin prophylaxis. Pre-transplant colonized participants exhibited a higher median baseline relative abundance of enterobacterales at 4.7% compared to 0.3% in non-colonized patients, alongside a higher abundance of bacteroidales. Following the initiation of levofloxacin prophylaxis, the relative abundance of enterobacterales declined in uncolonized patients but expanded in approximately one-third of colonized participants, a microbial shift that directly preceded bloodstream infection. Although colonization density and overall microbial diversity did not differ between those who did and did not develop bacteremia, this specific post-prophylaxis expansion highlights a vulnerable window where antimicrobial pressure may select for high-risk pathobionts in the gut. Shifting to outpatient viral respiratory care, Open Forum Infectious Diseases published a retrospective cohort study examining antiviral dispensing patterns among nearly 550,000 influenza outpatients under 65 years of age with underlying medical conditions across commercial and Medicaid insurance databases in the United States. Chronic pulmonary disease was by far the most common underlying condition, present in over 80% of encounters. Despite national guidelines recommending prompt treatment for high-risk outpatients, antivirals almost exclusively oseltamivir were dispensed in only 54.2% of commercial encounters and 53.7% of Medicaid encounters. Same-day dispensing occurred in 91.1% of commercial encounters but dropped to 81.4% for Medicaid patients. Overall dispensing was lowest among patients seen in emergency departments or with multiple outpatient visits, and delays were more pronounced among patients with multiple underlying medical conditions or Medicaid coverage. For practicing clinicians, this study underscores a major implementation gap. Nearly half of high-risk influenza patients leave outpatient settings without receiving recommended antiviral therapy, with vulnerable populations experiencing the longest treatment delays. Staying with Open Forum Infectious Diseases, researchers evaluated baseline quantiferon TB gold plus interferon gamma concentrations for predicting progression to symptomatic tuberculosis in over 5,240 participants, aged 15 to 34 years across global high-burden settings. Over a median follow-up of 525 days, baseline TB2 interferon gamma concentrations were significantly higher among participants who developed suspected or laboratory-confirmed tuberculosis compared to healthy controls. Among participants meeting a stringent microbiological case definition, baseline TB2 concentrations achieved an area under the receiver operating characteristic curve of 0.84, with a sensitivity of 80% and a specificity of 78%, meeting or exceeding World Health Organization thresholds for predictive biomarkers. These quantitative findings suggest that high interferon gamma levels on interferon gamma release assays can help risk stratify latent infections and support targeted preventive therapy in high-burden environments. Finally, recent reports in emerging infectious diseases highlight pressing outbreak dynamics and emerging vector-borne pathogens. An ongoing measles outbreak in Israel involving approximately 3,200 cases and 16 deaths has severely threatened the country's elimination status, driven by declining vaccination rates and traced via genomic sequencing to a single importation event. In a separate report from New York in the United States, pediatric clinicians documented a case of southern tick-associated rash illness in a child following an Amblyomma americanum tick bite, with Borrelia lownstari detected in the offending tick. Together, these reports emphasize the continuous challenge of managing vaccine-preventable resurgences and recognizing atypical tick-borne presentations in clinical practice. If you only have time for one paper this week, make it the PediCAP trial. It provides robust multi-country trial data, proving that oral amoxicillin step-down and a shortened 4 to 5-day total antibiotic course are safe and non-inferior to prolonged intravenous therapy in hospitalized children with severe pneumonia. Here are the key takeaways from this week in infectious disease. Oral amoxicillin step-down and 4 to 5-day total durations are safe and non-inferior to intravenous therapy for severe community-acquired pneumonia in children. Fluoroquinolone-resistant enterobacterals colonization in transplant recipients is frequently marked by an expansion of gut enterobacterals during levofloxacin prophylaxis that precedes bloodstream infection. Antiviral treatment is dispensed to only about half of high-risk influenza outpatients in the United States, with significant delays seen in Medicaid beneficiaries and patients with multiple comorbidities. Quantitative quantiferin TB plus TB2, interferon gamma concentrations show strong predictive accuracy for progression to active tuberculosis in high-burden settings. Measles outbreaks driven by dropping immunization rates threaten elimination milestones, requiring rapid genomic surveillance and aggressive vaccination catch-up. That's your roundup for this week in infectious disease. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.